Yeah, so the next slide is the big beautiful bill.
Yeah.
You taking this on then?
Yeah. We all love talking about the big beautiful bill, right? So I'm gonna get blind. Sorry, everybody. So we've got tonight HR1, the big beautiful bill, passed in the House a few weeks ago. It's the reconciliation bill, is basically the federal budget. Everybody, if you don't know who I am, I'm Joe Sackman, Executive Director here at Long Island Progressive Coalition. Got some great people that are joining us tonight for a panel. We've got Mark Haney, Director of Metro New York Healthcare for All, Kate Selden, Senior Policy Manager at Solar One, Caitlin, you can correct me? Pavlikovich, from Planned Parenthood, Hudson Peconic, and Cynthia Ngombe, I think you're there too. I didn't see you earlier. I'm going to volunteer you if you're there. I think I saw your name. I thought I'd fix up the slide too, but the slide seems to doesn't have Cynthia on there. So, but let's go to the next one. So, a recipe for a catastrophe. What's in this bill? This is a 1,000-page bill, and this is just the short list of what's in the bill. Cuts to SNAP, cuts to energy investments, Medicaid, Medicare, the ACA, tax breaks on silencers for guns.
Yeah,
why
suppressors.
Why do anyone need tax breaks for gun purchasing and silencers? Defunding Planned Parenthood, and a lot more. A lot of horrific things. Just to give billionaires 4.5 trillion in tax breaks, and yeah, boo! Everybody boo! So. All right, so let's go to the next slide. How much will they cut? Well, you know, as of the first reconciliation bill, that passing was over $1 trillion to our services like Medicaid and Medicare and SNAP. This is like really horrific, and we're going to discuss more about like what this means for New York State, for the nation, for our communities. The next slide. And who benefits? I think I already mentioned this. The billionaires benefit, not us. Next slide. And what's it mean for the rest of us? Right, nothing good. I don't see anything good in this bill, not for any of us. All right, so let's get into it. So I'm gonna call on Mark Haney. I think he's here now.
Yep, I'm here.
All right. Thanks, Mark, for joining us. If you can start us off and like give us an idea of like what's going on with the reconciliation bill, where it's at, and like what it means for New York State that we're going to have these cuts to Medicaid and Medicare. If you start us off, we'd appreciate that.
Sure. So what a budget reconciliation bill is a 10-year budget plan for the federal government to follow as it crafts its individual year-by-year budgets. So that's what it is. It's a bill that, according to the rules of the Senate, must directly deal and only deal with spending cuts, spending increases, tax cuts or tax increases, and theoretically ways to lower the federal deficits and debt. And by adhering strictly to those things and only those things, then when a budget reconciliation bill is taken up in the Senate, it does not face the possibility of a filibuster. So that's sort of the legislative trade-off here. What the Trump administration and their allies in Congress have proposed in this particular budget reconciliation bill, and it's a process that every so often is invoked by Congress, but not every year. So this is sort of an unusual circumstance. And it's invoked by Congress typically when they want to pass something major that relates to one of those three categories: taxes, spending, or deficit reduction and debt reduction. Um, that they know they're not going to be able to do on the Senate side without facing a filibuster. So this is what they're doing. In this particular budget bill, as Joe sort of laid out, they're proposing to provide a huge tax cut, not just for billionaires, although that's gotten a lot of the attention, but also for big corporations and special interests. And that totals up to, depending on how you're looking at it, and the new Senate bill that came out a couple of days ago, Senate version of the bill, contemplates upwards of a $5 trillion tax cut over that 10-year period. That's a lot of money. And so they've got to figure out how are they going to pay for this. So they proposed upwards of $2 trillion in spending cuts. About $1 trillion of that will come out of healthcare. The other trillion will come out of other things like SNAP and other sorts of things, public schools, ending the tax credits for green energy and so forth. And I'm not going to steal other people's thunder on that, but a variety of things. They want to increase spending upwards of $2 trillion for the Pentagon, Department of Homeland Security primarily, which means, and a lot of that is going to go to beefing up their whole ICE operation and border security and deporting people and like that. And so of this upwards of $5 trillion, $2 trillion of which they're going to pay for increases paid for by spending cuts. The other $3 trillion, they're just going to throw on the debt and deficit pile and not worry about it, which is a lot of money. And it's this increase in the debt and deficit that will automatically trigger cuts to programs like Medicare and some other things that are called for by a separate piece of legislation that was enacted back in 2010 in the early Obama years, that's called the Pay As You Go Act. And what that bill says is when debts and deficit increase above a certain rate or amount, then automatic across the board spending cuts starts to happen in a number of areas. And I believe that may also uh, happen on the Pentagon side of things, but I'm not an expert in that. So that's broadly what Congress is trying to do here. And so the healthcare cuts are far and away the biggest chunk of cuts in the spending cuts part of this package. And they're mostly focusing those on healthcare programs that low income and working families rely on. That is Medicaid and the Affordable Care Act. And the Congressional Budget Office has analyzed the House bill that passed a few weeks ago. And again, the Senate put out its version of it earlier this week. And the CBO is saying that nationally, over this 10-year period, about 16 million people will lose their health insurance coverage. A little over half on the Medicaid side of things, a little less than half of that amount on the Affordable Care Act side of things. And so that's what will happen on healthcare. And this will ripple throughout the healthcare system. So it's not just that people will lose their health insurance, as bad as that may be, but it will cause healthcare prices and costs to rise for everybody. it will put elements of our healthcare delivery system at risk, particularly hospitals that are teetering on the edge of uh, financial difficulties, like Nassau University Medical Center, that is definitely on the ropes at the current moment. So we're going to see hospitals close potentially and clinics close. Healthcare prices will go up for everybody. Health insurance markets will become less stable. So it causes lots of bad ripple effects. So people are really responding to this bill once they know what's in it. They don't like it. New polling that's been coming out this week is showing that on average, 2/3 of the American public doesn't like what's in this bill once they're told about it. They particularly don't like the healthcare cuts because that affects every family and every person individually. They actually think we should be spending more on healthcare programs like Medicaid, Medicare, and the Affordable Care Act. So Congress is going the opposite direction from where the public wants them to go. So that's kind of it. In terms of the legislative process, the House passed its version of this bill at the very end of May, before they went out on the Memorial Day recess. The Senate is taking up the bill right now, this month, and they want to get their version done by the end of this month before they go out on the July 4th recess period. And depending on how fast they do or don't do their version of it, they may actually kick it back over to the House before July 4th break for the House to deal with. But we'll see how that goes. What they're trying to do is craft a bill that the Senate will be able to pass, that they'll get enough votes to do it, a bare majority of votes. So that means 50 votes plus the vice president. They only have a 53 member majority in the Senate. And over on the House side, they only have about a 5-seat majority on the House side. The Republicans are trying to pass this bill all on their own. They're not including any Democrats or any Democratic leaders in any of the negotiations at all. They're shutting them out completely. So, given the slim margins, they've got a very difficult needle to thread. And they don't have enough votes yet on either the Senate side or the House side for this new Senate version. Although the leadership is working on it and trying to cut deals here and there. And the Trump administration is weighing in heavily to try to twist arms to get this bill done. They claim they want to get it done by July 4th. Whether they'll be able to do that or not, our job as advocates and activists has been all along from the get-go, slow this thing down, stall it out, make it really hard for them, make them sweat on this issue as it moves forward. And I want to really say hats off to LIPC and what you're doing, and particularly the 2 Republican districts on Long Island, the 1st district and the 2nd district, that encompass pretty much most of Suffolk County, because you're really ramping up the energy and making them nervous, and you're holding an event outside one or both of those offices or in the district, almost one every week or two. And that's really extraordinary. And that's a lot of work to take on. And you're working with allies and other groups, like-minded groups in that district, and pulling folks together. And you've got your next event coming up on Friday in the 2nd district. So really kudos to you. Part of my own job, in addition to working in the greater New York City area and happy to partner with LIPC on what you're doing, is that I coordinate a statewide effort that's part of the National Healthcare for America Now umbrella campaign. And so what you folks are doing on Long Island as part of the New York State campaign, that's part of the national campaign, is really important because the speaker can only lose maybe 4 or 5 votes on the House side, and you're putting pressure on 2 of those 5 that we need. And there are other folks that are working in the lower Hudson Valley. My own group is working with a group here in New York City on the Staten Island district. So we're creating pressure in 4 of those 5 districts, and there are groups like us in other states around the country that are pressuring their vulnerable and House members in swing districts. And so together, hopefully, we're going to stop this bill from moving forward and getting to Trump's desk. So I guess I'll just kind of pause there. Either I can take some questions now or the other panelists can speak, and then we can all have some discussion and Q&A together. So back to you, Joe.
Thanks, Mark. Really appreciate, all the work you do into this. Mark comes out often to Long Island to help out. So it's always great to see him, and we can lean on him for a lot of the intel of what's happening at the federal level. So appreciate everything. Appreciate you coming.
One thing I should mention, and that's part of this mix, which both Garbarino and Lalota are going to talk about and have been talking about, and it's important for all the Republicans from New York, is the state and local tax deduction issue. Prior to Trump's first round of tax cuts in 2017, people could write off all their state and local taxes as a deduction on their federal income taxes. That was capped in the 2017 Trump tax cut law at $10,000, which is an issue for people in what's called higher tax states like New York, where we raise a fair amount of local and state taxes to do good things. Like, we have one of the best Medicaid and child health insurance programs in the country as states go. Ditto for the Affordable Care Act and lots of other things that we do with state and local taxes in New York, our school taxes and so forth. So, kudos for us for doing that. But before Trump's first tax cut bill, people could write all that off on their federal taxes, but it got capped under that. So both Republicans and Democrats, this has also been a main issue for Tom Suozzi and Laura Gillen in Nassau County. They want to remove this tax and go back to the way the things used to be. So this is a main issue right now for Republicans from New York, since they're trying to pass this bill by themselves. They're trying to, if not eliminate this cap on state and local taxes, what's called SALT taxes, which stands for state and local taxes, they got in the House bill 3 weeks ago, they raised it from the $10,000 cap to a $40,000 cap that will go up to that will step up to $50,000 over this 10-year period of the bill. So the Senate bill that just came out didn't do anything about this raising the state and local tax cap deduction at all. It keeps it at the $10,000 from the first Trump tax cut bill 8 years ago. So this is going to be a major thing that Lalota and Garbarino and their Republicans from New York and other blue states like New Jersey and California that care about this issue are going to be talking a lot about now again. And so many of us are kind of agnostic on the SALT tax issue, although the people who take it are primarily wealthy people because they itemize their taxes. Most regular everyday people don't do that. And in order to take the deduction, you have to itemize your taxes. But our message to them is going to be, don't trade away all this other stuff, healthcare, green energy, SNAP, whatever, just for this SALT cap deduction. You can't trade all this stuff away for that. And so that's another issue that's that sort of complicates the matter, particularly on Long Island.
Matter of fact, we had a great action around Lota, and we delivered them little salt packets saying, keep your salt if you're gonna cut our healthcare. And he was confronted. He was there in the office. We didn't expect him to be there, and he showed up just as people were delivering these little salt packets and their message, and he still came back with his BS about fraud and waste and etc. And there's a point that Caitlin brought up before to me. Since this is part of the original tax bill from Trump back in 2017, if that just expires, then the cap expires. So we don't even have to give the billionaires their tax cuts. We can also have our salt cap automatically raised and not cut any services if we just let the Trump tax cuts from 2017 sunset and move forward. I mean, it sounds simple, and it should be that simple, but I mean, that's really how it is, right? We don't have to have this fight that they're creating if we don't have to have a deficit that just goes up by trillions of dollars. We don't have to cut trillions of dollars in services. We don't have to do all these things that are harm so many millions of Americans directly and indirectly. And if we just let this stuff go, billionaires don't need more money.
Yep. The number of uninsured that would lose coverage in New York is estimated to be about 1.5 million people. And it would, just from the healthcare side of things, not considering any other financial impacts, would blow, the governor's office estimates that it would blow a huge $13.5 billion hole in the New York State budget if this bill moves forward. So we've got some serious things on the line here in New York. And when we look at who would actually lose their health insurance coverage in New York, it's a significant number of legal immigrants that get coverage through a special program we created under the Affordable Care Act called the Essential Plan, which is for lower income working poor families and people who don't qualify for Medicaid. So that's a special issue we also have to think about here in New York.
Thanks, Mark. We may come back to you. I want to move it forward. We're going to switch it up a little. We're going to go back to healthcare, but we've got Kate from Solar One. If you're there, I think you've got some info for us around what will happen with this big expletive bill if it passes.
Yeah, hi everyone. I also have some slides because I'm a visual person, and so I always feel like it helps to show some things. So let's see if I can do this.
Yeah.
I think I gave her permission.
Yeah.
Yes, okay, this should work. Okay, can you see my screen?
Yeah, we got to stop our share. There we go.
There we go.
Okay, you're seeing it now?
Yep.
Great. Okay. Thank you so much, Mark, for all that information. It's I've been so deep in the weeds on the environmental climate stuff, so it's good to kind of round out my knowledge. I knew it was bad.
Forward to learning from you about the climate stuff, because I don't know that.
Well, good. It's a share then. Well, just to introduce myself, I'm Kate Selden. I'm the Senior Policy Manager at Solar One. And we, just for background, Solar One's an environmental nonprofit. We're based in New York City. We do a bunch of different programs like park stewardship, green workforce training, K-12 climate education. And then we have a team called Here Comes Solar, which I'm part of, that provides solar technical assistance and does policy advocacy, and all really in efforts to make solar and its savings more affordable, accessible, and equitable. And I do just want to say before I dive into like all the impacts on the environmental stuff, you know, I really see these as all really interconnected issues. And, you know, whether it's cutting things like Medicaid and SNAP, and other programs for working people, or it's cutting clean energy programs, is really ultimately just going to make life harder for families and children to grow up in, and have safe and clean air and economic stability, and environmental justice in their communities. So I see this as like a full-scale attack on everything that could be just and livable about our future. And I think we have to fight for all of these things. So that's my soapbox, but getting into what's going on. So first, I just wanted to like ground us a little bit in like what is it that we stand to lose. And so, climate experts have long told us that to avoid the worst and catastrophic climate impacts, the world really has to achieve a net zero carbon emissions by 2050. And every single 1/10 of a degree we go over is going to make those impacts even worse. And so it's really a terrifying moment for our future to be in the hands of this administration and these congressional Republicans, because we're on such a tight timeline and we're already behind. And so this chart just shows us how much wind and solar need to be built, and renewable energy need to be built to even get to that 2050 target. And the last administration recognized that and acknowledged its existence. And so one of the ways to get there was by passing the 2022 Inflation Reduction Act, which was invested $369 billion in climate solutions and environmental justice programs. And it was the largest investment ever in climate in this country. And the goal was this orange bar, just to put us more on the pathway to reducing our emissions, while also stimulating green jobs and domestic manufacturing and giving communities tools to address climate solutions. And so that's kind of like what they're talking about dismantling. And so the IRA, the Inflation Reduction Act, did that by tackling sectors like energy, manufacturing, environment, transportation and EVs, agriculture and water, and through a bunch of different mechanisms. So tax credits and tax incentives were the biggest one, and that's where we saw the solar and wind tax credit that we already had in place, but they expanded it, increased it, and extended it for 10 years, and also extended it to other forms of clean energy, like storage and geothermal, things like that. But the IRA also included tax incentives for consumers. So like people putting rooftop solar on their homes or doing home electrification and efficiency. And then there were grants for programs aimed at making climate solutions more affordable and equitable, and then other loans and changes to federal operations, like increasing IRS enforcement so that we actually are collecting money from people trying to, like wealthy people trying to get through loopholes. And that was one of the ways to pay for this. And so in practice, what that did is really accelerated our transition to renewable energy sources like wind, solar, and battery storage. And this chart shows how much in 2025 we're expecting to build because of all these incentives. That's just this year. And so it's been an astronomical impact on increasing our clean energy. And it also has made things like community solar, where everyday people who can't put solar on their own homes can benefit from solar energy by subscribing, or rooftop solar. It's also expanded access to things like heat pumps. And so this picture is a building that we did a tour for in my organization. They put heat pumps and solar together, and it's a co-op in Brooklyn. And these are all the incentives that NYSERDA has on their website that the IRA funded. And then it also funded things like this We Act Thriving Communities Technical Assistance Center that helped environmental justice and low-income communities access grant funding, and then build out of EVs. And then it really stimulated domestic manufacturing for clean energy. So this is a solar panel factory in Alabama. And it also required that a lot of these investments pay prevailing wage. So these are really creating family sustaining jobs. So it was astronomical. And I just want to highlight this because this is what they're talking about cutting when we talk about clean energy cuts. And so just to kind of go through what specifically it's going to cut, and then I'm going to talk about the impacts. So, despite all of the great things I just talked about, it is proposing to cut clean energy tax incentives, and with a special target on solar and wind. It is proposing to rescind or cancel grant funding and loans. So there was something called the Greenhouse Gas Reduction Fund it's trying to eliminate. It's rescinding or canceling environmental justice programs like that TCTAC program I showed. It's accelerating fossil fuel permitting. At the same time, it's weakening NEPA, our environmental review process that is in there to protect communities and ecosystems. It removes a federal methane fee that was passed as part of the Inflation Reduction Act. And so basically it removes a fee that oil and gas operators have to pay if they go over a certain amount of emissions. It repeals a vehicle emission standard that's really helped drive down emissions from trucks and cars, and a ton of other things. And this is a very sweeping, the biggest climate investment ever, and so there's a lot more that it undoes. But those are some of the big ones. So now I want to turn to look at what does that mean for us? What does that mean for our communities and our country and our future? So I think one of the big ones is that we're all going to have to pay more for our household energy. And so, there's been a lot of modeling about what a full repeal or partial repeal of the Inflation Reduction Act would do. And, in essence, well, this map shows that, by 2035, if these cuts are made, the increase in household energy costs will go up anywhere from $100 to $900 a year per household. And depending on what state, it might be worse. And that's because cutting tax credits for clean energy technologies like wind and solar makes them much more expensive and less plentiful. And so then it drives demand for our fossil fuels, so natural gas and even coal in the short term. And so that's going to push up the price of those fossil fuels. And we're going to pay more for our home energy bills, but also for gasoline at the pump. And so they're saying all this stuff about affordability, and this bill is going to drive up the costs that everyone is paying on a day-to-day basis for energy. And then at the same time, it's cutting programs for energy efficiency, which it had in the IRA. And those energy efficiency programs are what help people reduce their energy use. And all of this has an outsized impact on lower income households because they're paying a larger share of their income for energy. So this is massively unaffordable. And then it's obviously going to put more air pollution in communities because it's eliminating climate regulations and the things like the methane fee. And so it's going to increase pollution from power plants and vehicles. And really, because of that slowdown in renewable energy production, we're going to keep relying on things that pollute more. And we know, air pollution has disproportionate impacts on communities of color and low-income communities. And so those disparities are only going to get worse. And at the same time, one more thing it does is it allows for sponsors, like developers of oil and gas who are building projects to basically pay a fee to get out of and sidestep our environmental review process, NEPA. Which is just extremely corrupt. And so another impact is more climate change disasters. I probably don't need to tell you all, how that might look. I think, New Yorkers are experiencing that firsthand already: heat waves, flooding, wildfire smoke. And because of the slowdown and that momentum of clean energy, we'll probably miss all those targets that I showed in the beginning of what we need to do to get to avoid the worst catastrophic impacts. And so, some estimates show that with all the cuts, we'd release more than the entire annual emissions of Spain. So our emissions are just going to continue to go up. So we're really, missing that very short window we have to really tackle and slow down climate change. And then there's the risks to our grid. And so, we have had surging demand recently for electricity. And a lot of that is driven by AI and data centers. And this chart just shows all the different regions and what they forecast in terms of how much energy they're going to need. And we had all this momentum going with renewables and storage. And this chart just shows that, if we cut all the incentives for those programs, primarily wind, solar, and battery, this is what we stand to lose in terms of generation each year. And then there's not enough gas to be built to make up for it. It takes a long time to build new gas infrastructure. And they're waiting for parts. The supply chains have slowed down. So it's completely illogical, if their whole theme is energy dominance, to cut these programs, given the demand that is coming. And then there's the jobs and domestic manufacturing loss that we're expecting to see. So this is a chart from the Solar Energy Industries Association, just showing the solar industry. So, and this doesn't even account for like the broader clean energy sectors. But in solar, they're looking at 330,000 jobs lost, hundreds of factories closed, and billions in local investments just erased. And this was a huge driver of bringing clean energy manufacturing to this country. And a lot of factories are now stuttering or closing or not opening. So, and then finally, there's a lot of really important programs in the IRA for local communities and environmental justice. These are just a few of them. But the intention of these was really to make funding available for local communities and make the transition more equitable, by giving communities the ability to design their own programs and really address like local needs. It's proposing to rescind any unspent funds. The APA is already trying to take back money that was already obligated. But through this budget bill, they're trying to just eliminate the sections of the IRA law that allow for these programs. So it's very devastating to all of the momentum we had and to all of the progress we were making. And it comes at a really terrible time in this very short window we have to make things a little bit better. And then, I work in solar, so I have the most detailed knowledge of what's happening in the solar. So I'm happy to answer questions. Basically, they're trying to, solar is part of the clean energy tax credits. So they're basically between the House and the Senate, ending them anywhere from 2 months to a couple of years. We'll see where the final version ends up, but it's ending residential solar, commercial, like larger scale solar, and then a bunch of other provisions. But the summary is it's really bad. I did want to mention in terms of what you can do about it. I think Mark did a great job of explaining this, but Garbarino, House Rep Garbarino, wrote a letter and got a bunch of other House reps to sign on, saying how they should save, to his fellow Republicans, how they should save clean energy tax credits. And Lalota signed it. And so there was some sense that maybe these Republicans would stand up. They did not. They slept through the vote and were cowardly and didn't actually, stand up for the thing they said they wanted. But I do think it gives you all really, and I'm saying you all because I don't live on Long Island, but Long Islanders a really important opportunity to push them on this and really hold them accountable for the things that they said they were going to do. So yeah, I also want to commend LIPC for all the work you're doing, and I'm really grateful to be here. Thanks, everyone.
Thank you, Kate.
Thank you,
There's a
Kate.
lot of information. I think one of the takeaways I have on this is that, looking at the intersection of the loss of, just taking the loss of jobs, just that point there alone, right? 330,000 jobs, no new factories opening up, no new jobs being created. And then they're attacking our healthcare. All those individuals who have jobs today will lose them tomorrow, will lose their health care. Where are they going to go? Right? And just we deal with a lot of environmental justice and racial justice in our work. We've seen firsthand how the tic-tac, the TCTAC, I just like to say tic-tac, the tic-tac program and WE Act, et cetera. The loss of the grants through the EPA, it's an attack, right? It's not even like a, hey, let's do this because it's no longer fiscally a good idea, or we don't need to do it anymore. It's an attack an attack on all of us. And the bill just is a classist, racist bill that is going to harm the most people it can harm when it's passed. This is a good example of how healthcare and environmental justice intersect, and also the economic justice part of it, like bringing the equality and equity, to having access to these tax rebates. I mean, we've done work where, houses of worship were able to get those tax breaks to get solar onto their buildings, where town of Islip is working on getting solar built on their affordable housing units. And this is all under threat. And it's, I really appreciate you coming on and bringing this, to attention. And if anyone has any questions for Kate, you can ask them now, or maybe we go back to our Q&A, because I've got 2 more people I want to bring up to talk about the effects of the bill. But, put your questions in the chat and we'll keep it moving. Next up, I'm gonna call on Caitlin from Planned Parenthood.
Great. Can folks hear me? I'm in the room. I don't know if you can see me. It's a little dark in here. Oh yeah, there I am in my pink shirt. Okay, great. So my name is Caitlin Publicoit, and I'm the Advocacy and Government Relations Coordinator here in Suffolk County for Planned Parenthood Hudson-Peconic Action Fund. I'm thankful to be invited into this conversation to talk about the impacts of this bill. As Joe was saying, it really is targeting groups of people and communities that are doing good. So in addition to what Mark was sharing about cuts to Medicaid, which would certainly impact people in New York, on Long Island, across the country, and have ripple effects throughout the healthcare system, which we know is fragile already. As Joe was saying, when someone loses their job, they don't always have access to healthcare. And we know reimbursement rates are low. We know there's not enough providers. I think we saw during the COVID pandemic that, again, our healthcare infrastructure is fragile. So if Medicaid gets cut, that would increase those sort of breaking points. So that is certainly concerning to us. And both the Senate and the House, in their reconciliation bills thus far, have included a provision that targets Planned Parenthood specifically. It would remove Planned Parenthood as a Medicaid provider. So even if Medicaid wasn't cut, or if there was less cuts, they're still proposing to take Planned Parenthood off of Medicaid. And so Planned Parenthood affiliates and health centers are they're healthcare providers. That is first and foremost the service that is provided through Planned Parenthood. And so a person comes to a health center, receives a diagnosis, a consultation, treatment, medication, and then that is billed through Medicaid. So like any other healthcare entity that sees patients, especially patients that are on public programs like Medicaid, we then reimburse and are being given that money through the government. So it's not like we're being funded solely by the government. There's not a line item in the budget that says this is for Planned Parenthood. It's just, we are a healthcare provider. And so again, they're targeting Planned Parenthood specifically, singling it out from other healthcare entities. And we know that if this happens, if the language stays in both House bills, I think Mark was saying that they have to match. If they stay in both House bills and they get passed, and the president signs it, many people will be losing access to a Planned Parenthood provider. And so here, as a Planned Parenthood of Hudson-Peconic, this affiliate, over 50% of patients are Medicaid patients. So that means those folks have to find somewhere else to go for their pap smears and their breast exams, their gender affirming care, their STI testing, their HIV PrEP and PEP. And there are other health centers on Long Island that do receive Medicaid, but they would have to, increase their capacity to receive patients at over 50%. And so it just puts a strain on the system. People are losing relationships with their providers and centers that they trust. They'll have a harder time finding where else to go. Those centers will have a harder time receiving them and serving them in a timely manner. And so again, just puts everybody at risk in this fragile healthcare system. And so, as I was saying, Planned Parenthood specifically is being targeted, separate from Medicaid cuts. And we know that Planned Parenthood is targeted because we provide abortion care. And so we provide abortion care in states where it's legal, and in New York it's legal. And so what this amounts to is an abortion ban across the country. It prevents Planned Parenthood centers in states where abortion is legal from providing abortion. And right now, since the overturning of Roe, which next week will be its 3-year anniversary, 20 states do have abortion bans. And so states that still provide abortion care, where it's protected by their state constitution or a recent ballot initiative, or in their laws, those states, again, are picking up the pieces. You have more and more patients leaving states with abortion bans to come to states that have abortion access. And so it's putting a strain on the system as well, that, again, leads to longer wait times. You have to travel farther. It costs more money to do that. Maybe you need childcare. You have to take time off of work. And that delays care, right? And delaying any care is just, it just causes mental and physical hardship. And we also know that in many of these states with abortion bans, maternal mortality rates are increasing. So more mothers are dying, more babies are dying, and we have a very high infant and maternal mortality rate in, as someone was saying earlier, like one of the wealthiest countries in the nation, or in the world rather. And so to know that decreasing sexual and reproductive care is really impacting families and their ability to grow the family they want, to be alive for the family that they have, is concerning. And so we believe that lawmakers know that making abortion harder to access and cutting health insurance is deadly. It's absolutely deadly. Again, they seem to have different priorities, so we do keep needing to reach out to them to let them know that we do not support this, that this bill is life-threatening, and that it should not become law. Almost 95% of people across the country believe that everyone should have access to reproductive health care. And 77% of people specifically oppose the Trump administration taking away funding from Planned Parenthood. So again, more than a majority of this country realizes that this is not what they want, because they're targeting us for the abortion care we provide, and abortion is not the only care we provide. Lawmakers are sacrificing access to all sorts of affordable care. So again, last year, Planned Parenthood Hudson-Peconic completed over 19,500 visits for Suffolk County residents, providing vital health care like birth control, STI testing and treatment, HIV treatment and testing, cancer screenings, HPV vaccines, gender affirming care, right? These are things that people need on a regular basis. And so we know, and just to be clear, right, Parenthood health centers save lives. We know what happens when health centers go defunded, right? Cancers are undetected, right? So they become more virulent in someone's body, they're harder to treat. STIs go untreated, right? More likely to spread in the community, can affect fertility, right? Birth control is harder to get. And so families, again, cannot make those decisions that's right for them about how many children they want or don't want. And our public health infrastructure is just breaking down. And so we hear lawmakers talking about, you know, cutting waste and fraud and saving money and being more efficient, but defunding Planned Parenthood specifically, right, is not going to save taxpayers' money. It's not going to save states' money. As Mark was saying earlier, you know, folks pull off Medicaid, it's $13 billion, I think we said, in the state budget that it has to get filled. So this can cost millions of dollars, right? Millions of dollars that states have to fill in, just millions of dollars of people now having costs that they can't meet because they don't have adequate health insurance and they don't have providers that they can see. So again, we know voters don't want this. Planned Parenthood is more popular than any elected official or party in our country currently, and we know voters do not want politicians interfering in their health care. Again, there's been a lot of ballot initiatives recently and they pass with a majority, right? Keep politicians out of our health care. And so this bill then is a direct attack on our freedoms, right? It's preventing myself and all of us in this room and the people in our community from the freedom to decide what's best for us, right? And what healthcare we need and what health services we want. And it's important to keep politicians out of those decisions. So we definitely have a fight ahead of us, but we are strong. Planned Parenthood Hudson Peconic has been here for 90 years. And so that's a really long time. And I think Monique said it earlier, just in terms of the fight with the system. You know, we're up for it. We've overcome difficulties before, and we will overcome this one. Again, I think this is a pretty connected and active group. Like, definitely call your congressman and let them know that you support Planned Parenthood. Let them know you don't support their salt. Let them know you don't support those climate cuts. You know, I think they need to hear exactly what people are caring about and paying attention and watching and trying to hold them accountable for, especially when they sign letters. So that's some of what we've got going on over here. And again, happy to take questions.